Hi there, Olweni. Igama lam nguLwanda. I am a pharmacist. Um, I want to just quickly speak about um, paracetamol. I want to also speak about non-steroidal anti-inflammatory medicines or non-steroidal anti-inflammatory drugs, which we call NSAIDs. Um, we're speaking about temperature control of these, what formulations are available out there, how do you use them for adults and for children. But yeah, specifically, I think I want to focus on children. We're talking about fever, the high temperature. Body temperature is about 38, 38.7 degrees Celsius. If this goes up to about 39, 39.5, we are really going to start to worry. So a slight variation up in body temperature is something to worry about. As a young mom, as a mother in general, if you have a child, you want to always have a thermometer. Now, there is some confusion around these. Do you put it in the armpit? Do you put it in the mouth? Do you put it in the rectum? How does it work? Um, there's different types available out there. So there is an oral thermometer, and there is one that you put in the armpit, and there is one that is a rectal thermometer. The ones that we are out there now is usually the ones that you're going to put in the armpit, and it's quite accurate to record core temperature. So you don't want to take temperature in the extremities at the hands, because there it's going to be lower and it's going to be inaccurate. So your child is running a fever, you've probably taken them to the pharmacy or taken them to the doctor, you've used your thermometer at home, and you find that your child, it gets now paracetamol, and also it gets a non-steroidal anti-inflammatory drug. So we're going to put some names there, right? So for paracetamol, you're looking at products like Napamol, Panado, Calpol. So these have just pain block, have a plain paracetamol. Paracetamol is safe to be taken by a child, even at a month old, right? But the dosage would need to be adjusted accordingly. Then non-steroidal anti-inflammatory drugs will start from 6 months. And usually here we're talking about Ponac, Ponstal, Phenamin, acomefenamic acid, and that is the active ingredient in the products that I've mentioned. It's mefenamic acid. So I said that it's safe to be taken from 6 months of age by a newborn. Um, Important just to mention is the dosage. I've seen adults will say they don't like taking tablets, and they want to take a paracetamol syrup. So it's a standard, right? Across all paracetamol syrups will have the same amount of medicine, the same amount of active pharmaceutical ingredient or API per 5 mils. Um, Put differently, is a paracetamol syrup will have 120 milligram in every 5 milliliters of syrup. This is the dosage for the average child. It will be half if the child is very little. If we're talking about like a 1 month old child, we're looking at about 60 milligrams. An adult dosage, if we are talking a threshold, right? So there's something that we call a sub-therapeutic dose. For the dose to start working, we want it to be here, right? Here is the amount of medicine, and here is time. So on your Y is the concentration of medicine that we're going to find in your blood, and in your X is the amount of time that will pass. So if we give an adult, we want to give them 1 gram or 1,000 milligram. That 1,000 milligram dose will start from 0, and it will go up, and it will hit the dosage. It will hit the threshold. So at that point is when, as a patient, you start to feel a difference in terms of pain management. So paracetamol is for pain, and it helps for temperature. And non-steroidal anti-inflammatory drugs go a step further. They help for the pain, 1. 2 is the temperature. And 3 they help for inflammation as well. So they do go a step further. You are taking, as an adult now, 120 milligram. You're taking 10% of this dose. There's just absolutely no way that you're going to hit that mark. Um, but people can be malicious. They have their own reasons why they will say they want us to claim a syrup on their medical aid strictly for paracetamol. But for other medicines, they're just fine to take, they're okay to take tablets. Anyway, I digress. That's what I wanted to mention. There is also a product that is available called Empaped. It is a suppository. You insert it in the back. It also has paracetamol. So very important to not overdose and give Calpol, Panado, Napamol, or pain block syrup, and then at the same time give an Empaped suppository. It is strictly the same thing. The only difference is that we are looking at a difference in dosage form, but over and above that, it is the route of administration. So one is a suppository and one is a syrup. The dosage forms are different, and then the route of administration, one you take orally, and the other one is taken through the rectum. Those are the differences. Okay, yeah. So I think we're good. We've said. Oh, I also wanted to mention when it comes to the 5 milliliters, it's not advisable for you to use the silverware at home. Always ask the pharmacist or doctor for a medicine measure because that one is graduated. If you've seen people who work in the hospitality industry, they will have silverware, but it will be very specific. It will be written that up to this point, whatever is in here is 5 grams. Up to this point, whatever is here is 5 mils. But silverware that you buy at the supermarket is not done according to a standard. So whatever volume is in the teaspoon or tablespoon will vary depending on where you bought it from. You know what I'm talking about. Some seem more sharp, some seem wider, some seem narrow. So just always try to get a medicine measure, and you'll always know that you are giving 5 mils. Sometimes the patient says the medicine is not working, whereas they are giving a sub-therapeutic dose. We've said give 5 mils, and you are giving 2 mils, and you don't know that. You're saying that a teaspoon is a teaspoon is a teaspoon. This is not true. Okay. Quickly, I'll make an example about a popular example around a dietitian and a nutritionist. That dietitian will say, I want you to take so much protein, so much starch in your diet, and they'll give you this in grams, for your breakfast, lunch, and supper. And the nutritionist will most likely tell you the product that contains that amount of protein. Or they'll start to say the size of a fist when it comes to meat, then it gives you an understanding and it helps you as the patient. You know exactly how much spinach you need to take, or chicken or fish, right? So we've got the measurements correctly now. Always use a medicine measure from the pharmacy or the doctor for syrups. Now we go to what I wanted to speak about, which is the dosing. The parent is saying that, I am giving these medicines, but they don't seem to be working. I am giving this paracetamol. The pharmacist has advised that I must give it every 8 hours. So we've said this is time, and this is the amount of medicine in the blood. We give paracetamol here, and we've got that amount in the body, and it eventually goes down, right? So we say this is about 8 hours. You take another dose, and it goes down, and that's another 8 hours. Take a third dose in the day, and it goes down. That's about 8 hours. That's a 24-hour period. What you start noticing is these gaps. Yeah. What is going on here? there's no medicine. There's no medicine in the blood. Okay, and if we're talking about an antibiotic, this gives a chance to the bacteria or other to recover. If we're talking about whatever is causing you the fever or pain or inflammation, it starts to come back during that time. So the advice is you are giving both the anti-inflammatory, which could be Nurofen, ibugesic. Those products contain ibuprofen, or you could be giving Ponstal, adcomefenamic acid, Feminamine, and the likes, which contain mefenamic acid. You don't give two non-steroidal anti-inflammatory medicines. You give paracetamol and an anti-inflammatory. You have to choose one anti-inflammatory. Either you're going with mefenamic acid or ibuprofen. You're giving the paracetamol every 8 hours, and you've been advised to use the anti-inflammatory every 8 hours as well. So what you do is you give the paracetamol first, and you wait for 4 hours, and only then you start to give the anti-inflammatory. And that graph goes up, it's there, comes back, and that will be it's 8 hours. And then you give again a dosage, goes up, comes back, that's another 8 hours, goes up, comes back, that's another 8 hours. So every 4 hours now you are giving a medicine. However, you've started with paracetamol. After 4 hours, you've done mefenamic acid or ibuprofen. And then in another 4 hours, you're going back to your paracetamol, and you alternate like that. I don't know if you can see this, if it looks any clear, but that gap that used to be big has now lessened quite a bit. This means that the amount of medicine that is available and is able to work in the system, we have sustained the amount of medicine that is there, and we've sustained its effect. Unfortunately, when you drink medicine, your body does excrete it. It doesn't just stay there. It will metabolize it, so it breaks it down, and then eventually takes it out of your system, either through breathing, through the urine, or kidneys is the urine, or you will excrete it. So it's important to keep taking the dosage. When the pharmacist says every 4 hours, they mean every 4 hours. The medicine is not going to stay in your system all the time. That's that for today. Just a small trick on how to dose for your child when you're managing temperature. Thank you. Bye.